Hello again, everyone. Welcome back to my channel, and thank you for all of you who are avidly supporting all my videos and learning from them. I'm grateful. For those of you who's just seeing this for the first time, I'm JC. I'm a physiotherapist here in the UK, and I'm doing these vlogs, sharing my experiences, suggestions, recommendations, hopefully to help other physiotherapist who's trying to get a career here in the UK. Just to update you again, in my last video, I just mentioned that I was attending a respiratory course for internationally trained physios, and I've just finished the third day. So it's the final day of the online sessions. Um, and yes, so it was a very informative and helpful training. And if not the most that I've learned from it is all about the struggles and the challenges of the physiotherapists, internationally trained physiotherapists, trying to get a career here in the UK, especially in the field of respiratory field. I've thought of sharing the experience again, and thought of opening up this topic with this in this video, which is regarding how we as internationally trained physios prepare for getting a job here in the UK. So as I've told you before, we come here in the UK, coming in a different country, different way of approach in the profession, and for us to get a job, we need to prove that we're the best person to be hired, and that will be a challenge if we're not very much familiar of how we do things. So it's how try to present ourselves in the interviews, and prove that we've somehow know things or already familiarize ourselves about the UK setting, how the healthcare setting is in the country, and the basics. We don't need to prove much. I think that will be understandable, that will be expected from us as internationally trained, but somehow we need to prove that we're not a liability when we get in the job. So I've thought of sharing some ideas again in this video. Again, to reiterate, I've mentioned this before from my previous videos. If you were registered with HCPC, or the Healthcare and Professional Council here in the UK, you should have attended that webinar, which is joining the UK workforce. I hope you did, or I don't know if you didn't, if you received an email from them sharing some resources, which is very useful in our part. In the resources, would be talking about the HCPC standards, which you can find the topic itself from their website, and tackling different areas actually that you should basically know, especially communication, record keeping here in the country, professionalism, and things like that. And if you've just been updating yourself, there's an update that started last year, September 2023, and those HCPC standards were updated, and they even conducted some webinars on how to meet those standards as a registered physio. Hopefully you're up to date on that. and you know what I'm talking about. On those resources, it was also talking about indemnity. I hope you have an idea about that if you're trying to get a job here. Um, English, this will be our main language of communication here in this country, and it's not just learning the language, it's also learning how talking in the same context when you're in a healthcare setting, because this you can be knowing words or phrases that has different meanings, and how you say it has different meaning here in this country. So that topic is also shared by that resource given by HCPC, talking about communication in healthcare and how it's delivered in the right context. Um, have a read about motivational interviewing, and make sure if you can find that your resources are from the UK, and it's UK made, that will be better. Safeguarding and other legislations, I'll talk about it later as well. Um, uh, NHS England, so what is the national healthcare service here in this country, how it's run, how it's funded, things like that. Those were some of the topics shared by HCPC on those resources. So I hope you received them. If not, maybe you can check the HCPC website or contact them about it. Also, I've also thought of checking out the NHS Learning Hub. I'm very not sure if you're able to do this if you're not working yet, but it's a very useful website where you can do some online learning on different topics that I've mentioned about, and some specific ones that you want to learn more about. I just checked the website again, and you can just type in the words of the topics that you want to learn from, and it will show up different things. Typing physio, it showed topics like community work, those kind of things. And then I also thought, because I did this course, I did this when I came here, the health and social care NVQ is a qualification. It's just like a simple low-level qualification here in the UK, but you get in that course, in that qualification, you get an idea of the basics of healthcare, and they'll be talking about legislation, the healthcare legislations, how patient care is done here in this country. It's very helpful if you'll be able to be able to get that at some point. But if not, maybe if you can find online resources, trainings about the UK healthcare legislations and guidelines, because that will be the basis of a lot of things in your interview, especially in the questioning in the interviews, and how we work here. So it's not just learning about the skills, physio skills and knowledge, but also presenting it in your interviews, that you know how it's done in this country. Things I'm talking about, I mentioned earlier about safeguarding. So here in this country, they're particular of how you take care of vulnerable adults and children as well. So have a read on something about that. They're also particular about like confidentiality, this anti-discrimination, and human rights, things like that. So things like that will affect our work, and we'll be dealing with that a lot in the things we do, like documentation. You need to be very careful of the things we write, legible, things like that, and it really contains the information needed in our patient care, because it's usually used for legal purposes. For example, if there is like an investigation after a death, so it can be very much important that you have the right information in your notes. This was even tackled in the respiratory training, about someone who shared about her experience about documentation and record keeping. So those kind of things, and also the guidelines, the healthcare guidelines that is used in this country. Have a check, have a read or Google about the NICE guidelines, because they usually base a lot of things on the pathways, protocols, in a lot of ways, even rehab or clinical or medical topics based on that guideline. So in this country, it's things, way of working is actually based on a lot of those kind of things, legislations, guidelines. Like for example, if in respiratory, they have this British Thoracic Society, so they have also guidelines about things, how we support diagnosis and rehab, how it's done, things like that. So yeah, there's a lot of things to read, but just giving you an idea. CSP as well. I've been sharing this already in my videos, that if you want help, and you're a CSP member, it's the Chartered Society of Physiotherapists. It's a professional union, as well as it can be helpful in a lot of ways as well, because it can be a resource for learning and development, giving you trainings, suggested signposting you to trainings and networking, things like that. So yeah, and it's where I do my mentoring scheme. So if you're a CSP member, make use of their resources. You check their website. They have this learning hub, and you can check topics that you want to know about. And it's not just that, it's learning how the profession is been delivered here in this country. So what topics, and what are the updates on it, and what's the how the rehab is approached. You can get an idea about that if you're a CSP member and you're getting those updates from CSP. As I've said, you can check the website, or I don't know if you're already here in the country, or you can access this. I think in their website as well, they have their monthly magazine, and yeah, you can get relevant, useful topics there that you can use. I've just been reading the past few journals, the past few issues. They mentioned about record keeping again. They mentioned about mental health. As I've said, it's one of the things you may want to learn about in the UK setting. They're particular with one's mental health. So it's not just like you have dementia or Alzheimer's. It's not just that, but it's how conditions can be affected by their mental health condition. For example, depression, anxiety, things like that. And that can happen with patients as well as with the professionals, even us. So that's an area that you might want to have a read as well. I've just read about frailty course, so that can be another topic that you want to have to explore as well. So elderly medicine is one of the elderly or geriatric is one of the areas that you might be frequently be encountering here, and so that's a good topic that you might want to learn from. So maybe falls or how to approach geriatric rehab, things like that. An issue talked about the 4 pillars as well of our profession. So I hope you know that. That's a common topic in the interviews. Clinical education, leadership, and research. So hope you have a read on that. And there's one issue that talked about updates on stroke. So those kind of things is a popular service here in the UK. So stroke, neurology, so yeah, those kind of things, and how it's being how the healthcare service is delivered around stroke here in this country. They also have networks, so they have the professional networks like for example for cancer, for orthopedics, for neurology, things like that. So if you want to be specifically know about specific specialities, then you can also explore those networks. They also have these non-professional networks which you can just interact and maybe learn from. They do meetings, they do webinars, so it's one way of getting to know how things are done here in the UK as well, and maybe learn from others. So yeah, it's a very useful resource if you are a CSP member. So those are the things that I've just thought about as ways of you getting to have a grasp of the UK healthcare settings and preparing yourself to have an idea in your interviews. I know we cannot present like that we have experience here in the UK, but we can maybe present ourselves that we have prepared for it. We have tried to learn from others how it is done, so you can surprise your panels in the interviews and give them the answers they want. So it's just how it goes. Also, I've shared this already before, but if you haven't preparing for it's just a quick grasp of different clinical settings and different areas and scenarios, and how to answer how to deal with it and answer questions. It can help you just have a basic idea of the different fields in physiotherapy here in the UK, and how to manage them. It also has some introduction part where it's talking about how you prepare for the interviews, or how to get to find a job, and what to expect. So it's the clinical case studies in physiotherapy, a guide for students and graduates by Guthrie. And that's what I've learned in those people who attended this course. So it's because it's their internationally trained physios, so you get an idea of how we were like having that culture shock or that struggle because of the difference in the training and the setting. Okay, hopefully that helps. For those of you who's a CSP member, as I mentioned, and you want some one-to-one support, just check out the mentoring scheme and look for my name, and hopefully we can connect. If there are topics that you wanted me to share, just comment on the comments box below. Also, just to share, this is not, I'm not pretending or portraying here some expert, okay? This is just sharing from the level of experience that I've had. It's just imparting them all to you. It's not, I cannot claim that I'm expert on anything. Maybe you know more than me if you've done your masters or more experience back home in your own country. So this is not about that. It's about just sharing tips and tricks about getting in the profession here in the UK. Okay, just to clarify that. Yes, so thank you all for listening and hope to see you in my next videos. Thank you.